There's Kelly. And you can just, she'll sit that off the side. So the next thing that you and your assistant have to do is we have to put in our ports. Well, that's true. We should. That's right. See, that's why you need your scrub nurse, because the surgeon just wants to start operating. We have to set up our equipment first because we don't have any picture yet.
So we're going to pass this end off. This end has to go in, so we'll pass that off to her.
So she's not sterile during the procedure, so she takes things off the field, and she's going to be plugging them in to the video tower.
So this is the camera.
So everything starts sterile, but you pass off an end that then becomes non-sterile.
This is the lens. What we'll do is return this over. So let's just try, hold on to this. Just turn that. Slip it in. Hold this one.
So Carol is showing her how to get the laparoscope set up into the instrument.
That's it. Okay. This is the light part.
And a lot of the stuff that we do is either, it can either be voice controlled or it's controlled by menus that we can play on the screen. And I'm just going to real quick show everybody. So when we're talking about laparoscopy, there's a couple different pieces of equipment. We have our scope. This is a lens, but that's all this is. This is just a lens like you might put on a camera, an SLR, a single lens reflex camera. This is actually the camera. So we can use different lenses on this camera. We can have long ones, short ones. We can have thicker ones or thinner ones, ones that articulate or the tips bend around, but they all have a common camera. And this is a high definition camera, or HD. So just like with your TVs you get at Best Buy, we're looking at a high definition picture here. But the cameras also have a separate light source, which is the fiber optic cord, and so that's where our light's going to come from. So let me give you, go ahead and you take over the control of that. So we're going to control all of our settings for our equipment. The surgeon can do them themselves. Now Carol, if she needs to, she can do it, but the nice thing about these equipments is the surgeon themselves can do it. So hit this big button and watch your screen now. So you're going to be kind of standing like that, looking at the head of the patient. Your assistant at some point is going to have to put her camera down, and she's going to have to come work.
Oh, can you? I'm taking video.
Oh, you're taking video?
I'm taking right now. So.
You're going to navigate through the options. So the first thing we want to do is we want to turn our light on. So this is, that's your select button, and that goes through your options. So hit your big button. And move it, and select down to 100%. Big button. So now your light source is on. Now the other thing that we would do if this was a real operation, we would be going to the insufflator, because if we're going to be operating in somebody's abdominal cavity, we have to maintain a space in there. So there's a machine that will instill gas into the belly and it will keep it inflated so that we can see what we're doing. But we don't need to do that on our model. The other thing that we have to do is we have to white balance our camera to kind of set up so the camera knows how to handle all the other colors. So we do that, point your camera right at this white bandage there. And so when you see nothing but white on the screen, I'm just going to do that for you. Hit the button for the white balance. And it says your white balance is okay. So now your scope is ready. So now you can set that down, give that, pass that back to Kelly. And you can just set that, that's all right. So then now we've got our camera set up. Next thing we have to do is we have to gain access into the belly cavity. So what you like to do, do we have a visit port?
Yeah.
Yeah. So we give that to Kelly. So we want to make sure we do this safely. We don't want to do things blindly. So obviously we don't want to just go take a port and shove it in the belly cavity. We want to see what we're doing. So we use a device called a visit port, which is the camera that goes right through one of our trocars. So go ahead and, yep, that looks good. Go ahead and grab your device. So now what this is, with this thing that looks like a machine gun, there's a blade at the end of that, and we can see, we're going to go through, can you turn the lights down just a little? Can you guys see that okay?
Yeah.
So there's a blade, and as we go through the layers of the abdominal wall, we're going to actually be able to see what we're doing. So let me give that back to you. And we're going to go through the belly button for your camera. So what you want to do is kind of go straight down at it and hold. Are you right-handed or left-handed?
Right-handed.
Okay, so what I'd like to do, I want my right hand on the trigger because you're going to shoot that like a gun. And as you go down, squeeze your trigger. You'll actually feel it click as you go. You push a little bit, and then you get in there. So now you're through the skin, and you can actually see, you're kind of starting to see your stomach on the inside there. So what you're going to do, you're going to slide that in a little bit, and then you're going to go ahead and take this whole thing, the whole thing out, take that out too, yeah. Pass that back to Kelly. So now, and Kelly, take the scope out of that, of the instrument, and let's give it back to our surgeon here. So now what you want to do, now that you've got that first port in, under direct visualization, go ahead and put your camera in it now. Now we can kind of look around, and that's how we'd always start an operation, by taking a quick survey of what's going on. So you can kind of see, by moving your hands like this, you're going to kind of look up. That's looking to the patient's left, that's looking to the patient's right. You can use this light cord. This is a chameleon.
Yeah.
So what we want to do now is, your assistant is going to put her trocars in, but you're going to be able to watch her. So go ahead and step up there. Now you want him to be able to see where you're at. So you just want to take your finger and kind of poke so he can see. So now you see about where she's going to be. Don't poke it all the way through. You did such a good job with that. So now you need to put a trocar in. So go ahead and you can ask for your trocar. You can hand that to her.
It's one thing the assistant doesn't say is whoops.
So right through that hole that we already cut, watch the screen. You're watching your screen, so you're operating here.
Oh, okay.
So you can kind of see as you're going through. Just push your trocar in.
The whole thing?
Well,
Yeah.
until you see the gray part come in. So
Gray.
there's your blade. Keep going. Keep going. So now you're starting to see your port come in there. Go in a little bit more. And stop there. So you're watching what you're doing, and your surgeon is kind of showing you you're not hurting anything. Everything is out of the way. So you can see you've got your port, which is this white part, and this is the kind of the blade that is helping you get through the skin. So hold your port and pull that inner sheath out. Yep, go ahead and pull that out. So now you've got a port in. Pass that back to your nurse, and go ahead and grab another one. Grab one of those small ones, maybe. So you're going to do the same thing at the other incision there. No, this is a new one. So you can let go of that now. You're okay there.
And do the same thing?
Yeah, you're gonna, but make sure that he can see where you're at. There you go. Pull that out.
Not
Okay.
too far.
Now you take the scope from your surgeon, and you're gonna hold it, and you're gonna watch him do the same thing. And we can kind of control what we're looking at by moving this light cord around. So you're gonna kind of want to look up, and just pretend like we're looking at the inside of the belly. So that's exactly right. You kind of figure out where you are, and go ahead and get a point. Let's get a 10 port. Actually, no, let's get a 5. Put a 5 in there. Very good. Go in a little bit more, and then go ahead, and that's probably good. And pull your inner catheter out. Now this, keep in mind that with this model, our artificial skin is very thin, and these ports are, you're like, why are they so long? But somebody's real abdominal wall may be 2 or 3 inches thick, so most of this is actually going to be in the thickness of the belly wall. So let's go ahead and let's get a 10-12 port, a bigger one, and do the same thing. And you know you're going to watch as it goes in, so kind of look where you, there you are, there you go. Good. A little bit more. That should be good. Very nice. So now we've got our access, and this is what a typical case might look like. We've got basically 2 ports for each surgeon plus a camera port. And we may, in our institution, we actually have a robot arm that holds the camera. But one of the things that the scrub nurse can help do is hold the camera while the surgeons are doing things. So Kelly, what we might ask you to do now is kind of hold the scope for us. And so what we see here, we have kind of our fake stomach in there. Yeah. See, the yellow thing is the stomach. So there's the esophagus, this body of the stomach. Those are supposed to be some blood vessels coming off the bottom, going into the small bowel there. So what we're going to want to do is we're going to want to divide the stomach. We're going to do a sleeve gastrectomy. So there's a couple things. You need a grasper, and so this is where you see how hard your job really is, because you're sitting here holding the camera while people are asking you for things. And when you hold the camera, you always want the buttons up. You can move this around, and that changes your view. But if you let the camera drift, it's kind of like if somebody were to take a movie camera and turn it sideways when they're filming a movie, and you kind of get the Blair Witch thing going on. So with one hand, you can just hold that camera, probably with that one, and then your other hand, you basically have your table with all these instruments behind you, and Carol's kind of helping you be a go-between. So the surgeon, you're gonna ask her for a stapler. And you're gonna put that through your bigger port, but you also both need instruments to help grab tissue. So go ahead and set that in just a little bit so you can get it in there and know that you don't have to worry about where it's at. And
You have to back right up.
yep. So the other thing is they all need graspers. So we're going to ask Kelly to pass them all graspers. Normally she just, yeah, we have graspers.
It is still
Gone.
going? It stopped?
Yeah, it's still going.
So the other thing that's probably
Oh.
going on is I'm realizing,
Huh?
oh man, I only have one staple loaded up, and I'm saying,
Oh, okay.
Carol,